Hello, this is Arabella Hayter. Let's start Module 12, where we will look at user-friendly WASH in healthcare facilities and how we can use WASH Fit to make WASH services more inclusive and accessible. This module is developed in collaboration with WaterAid. Please explore the reference section for this module to access links to all the resources mentioned. Also, if you'd like a more in-depth exploration of GEDSI, please take the Open WHO course, Mainstreaming of Gender Equality, Disability and Social Inclusion in WASH in Healthcare Facilities. By the end of this module, you'll understand how and why some healthcare users experience exclusion and discrimination. We will talk about how you can improve the engagement of vulnerable groups when implementing WASH Fit. For example, women, the elderly, people with disabilities, and Indigenous groups. Additionally, you'll be able to describe accessible and inclusive WASH solutions within healthcare settings, which are also reflected in the WASH Fit indicators. We will also look at a participatory tool called the barrier analysis approach, which you can use as part of WASH Fit to deepen your understanding of the challenges faced by certain individuals and groups. Did you know that globally, 1 in 10 patients acquires an infection while receiving care, leading to increased morbidity and mortality? Inadequate WASH services is a significant risk factor, with infections from unclean births causing 26% of neonatal and 11% of maternal deaths. This totals over 1 million fatalities annually. WASH also affects safety, dignity, and equity. A survey by the White Ribbon Alliance in 2019 across 114 countries highlighted WASH facilities as a top priority for over 1 million women and girls, second only to the need for respectful maternity care. As Matcha Porn In, a human rights defender from Thailand, notes, invisibility in daily life means needs are often overlooked, especially in times of crisis. Inadequate WASH facilities disproportionately affect certain individuals, especially in healthcare settings. Pause the video briefly to see if you can think of 3 to 5 factors that could impact a person's access to WASH. Factors such as age, gender, ethnicity, disability, caste, religion, or sexual orientation can influence access, with poverty amplifying these challenges. Marginalized groups also face greater discrimination and exclusion in accessing WASH and health services. Some people may even have a number of these identities that overlap and mean that they are even more susceptible to marginalization and exclusion. This is known as intersectional inequality. So what is inclusive WASH? These services are people-centered, accessible, and inclusive. Services encompass physical accessibility as well as socio-cultural acceptability, provided through the security, privacy, independence, and comfort of different users. Inclusive WASH covers a wide range of users: women in childbirth or menstruating, infants, children, older people, people with disabilities, people experiencing injuries, illnesses, or incontinence, and female staff. Effective WASH service design and management in healthcare facilities must cater to the diverse needs of these groups, while also navigating cultural sensitivities around menstruation and post-birth bleeding to safeguard women's health and protect against gender-based violence. The barriers that marginalized groups face are varied. Each of the groups shown here can have multiple identities that interact and intersect with each other, compounding impact and experiences of marginalization. Some barriers are physical and some are psychological. They affect not just patients, but those providing care, including family carers and guardians and support staff, for example, cleaners and waste workers. The WASH Fit team should try to identify and recognize all the types of marginalized groups and work with these groups to understand the barriers they face and their specific needs in each context. Remember, members of minority groups often have intersecting inequalities and may be faced with discrimination on multiple fronts. This motto, "Nothing about us without us," is used to communicate the idea that no policy should be decided by any representative without the full and direct participation of members of the group or groups affected by that policy. This is certainly true for WASH Fit, which requires the full participation and equalization of opportunities for, by, and with marginalized groups. At every step of WASH Fit, the team must consider diverse perspectives, whether during the assessment, when determining risks, or when coming up with solutions to improve the facility. We will now look at who needs to be on the WASH Fit team to help ensure diversity and inclusion in decision-making. What does a WASH Fit team look like? We touched on this earlier in Module 2, How to Build a Team. A diverse team should include people from marginalized groups, including women, people with disabilities, the elderly, individuals from lower income or education groups, and Indigenous groups. The teams should have a set of principles or ways of working to give everyone an equal voice. The team should also have an equal gender balance and include a diverse range of staff roles and levels, spanning from cleaners to nurses, midwives, directors, and managers. Additionally, it may involve healthcare facility users, such as a woman who has delivered a baby at the facility, who will be able to provide valuable input and insights. The makeup of the team will vary according to the local context and the size of facility and the type of services it provides. When planning and conducting meetings or workshops to make them more inclusive, assess participants' needs to facilitate their attendance and engagement. Is extra assistance or support required? Make sure that all materials are understood and accessible to all, including to those with low literacy or visual impairment. The meeting venue should be accessible, considering mobility, hearing, and vision requirements. Communication styles and facilitation techniques should accommodate diverse backgrounds and abilities. Ask, how can you encourage and facilitate more active and inclusive participation from all attendees? You will need to respect diverse viewpoints, particularly in discussions on sensitive topics like menstruation or incontinence. Can staff speak freely within the facility's hierarchy? This will ensure a safe space for open dialogue where everyone feels confident and comfortable to express themselves without fear. By considering these important issues, facilitators can create more productive, respectful, and inclusive events, making every participant feel valued and heard. Did you know that on any given day, more than 300 million women worldwide are menstruating? Consider what that might mean for staff working long hours in a healthcare setting without access to toilets and space to manage their menstrual hygiene needs. This nursing charge in India found managing menstruation while wearing PPE both shameful and difficult, and needed more support from hospital administrators. Menstrual health and hygiene management plays a fundamental role in enabling women and girls to reach their full potential. In a healthcare setting, this means both staff and patients. Menstrual health encompasses the physical, mental, and social well-being around the menstrual cycle and is more than just disease prevention. It's crucial for women, whether they are health workers, patients, or carers. Proper menstrual health management includes access to menstrual health information, hygienic practices and materials, as well as suitable wash facilities, which allow privacy for hygiene and changing and disposal of materials. Creating a supportive, stigma-free environment promotes positive menstrual experiences. Women should be actively involved in decision-making around menstrual health, and this includes being on the WASH Fit team. In order to ensure that WASH infrastructure are safe and accessible for all users, they should be designed with the following in mind. Toilets should be sex segregated and clearly marked. They should be well lit with lockable doors without gaps. Doorways or gates and ramps should be wide, and there should be enough space to maneuver inside if using a wheelchair, or for a caregiver or support person to provide assistance. Doors should be outward facing with low handles, and ramps should be at a safe gradient. In cases where ramps are not possible, steps should be wide enough to accommodate individuals with limited mobility. Additionally, tactile markers on the ground can assist individuals with visual impairments. Other features that improve accessibility include handrails, modified toilet seats, easy-to-use taps like those with longer handles, and a water source that is easy to reach for those in wheelchairs or of shorter stature, such as children. Hand-washing facilities must also be modified so they are at a low height and accessible to those using wheelchairs. Non-slip, flat flooring also helps. Participatory barrier analysis is a practical tool designed to deepen our understanding of the challenges faced by individuals and groups, and is used to identify and mitigate obstacles to effective WASH services. It can be effectively applied in various contexts. This exercise should be undertaken as part of the WASH Fit assessment to deepen the team's understanding of barriers that facility users might be facing. The analysis is really useful for uncovering hidden obstacles that may not be immediately apparent, ensuring that interventions are well targeted and comprehensive. It also gives a voice to diverse users. Lastly, it can also be a fun and engaging training tool that can be used with staff from all levels within ministries of health and the WASH sector. We will now look at an example of a barrier analysis exercise. Obstacles that prevent equitable access to WASH are categorized into three main types: physical, either natural or infrastructural, policy and institutional, and socio-cultural or attitudinal. On the next slide, we will show you some of these barriers. Take a moment here to pause the video and see if you can think of some of these barriers. The examples shown are not an exhaustive list, and the barriers may look different in your context. Here are some potential barriers. Physical barriers may be that facilities are far away from communities or accessible by uneven, wet paths. They may be inaccessible for wheelchair users, have an absence of handrails, and poor lighting. Institutional barriers may be a lack of gender equality policies in WASH, insufficient funding for adapting infrastructure, or limited inclusive training for staff. Social, cultural, and attitudinal barriers include stigma around menstruation, discrimination of people with disabilities, or violence against women and girls. This is just one example of how to analyze and organize common barriers experienced by marginalized groups. Using this framework can help to highlight the areas where an intervention can make the most difference. This will be different in different contexts. The next step is then to think about what the solutions are and how they can address each of these barriers. These solutions should be included in the WASH Fit Improvement Plan. You've now reached the end of Module 12. Here are the key points to remember. Marginalization and exclusion from WASH in healthcare facilities can occur due to gender, age, disability, ethnicity, and poverty. Barriers to accessing WASH in healthcare facilities can be social, physical, and institutional, often relating to power dynamics. WASH infrastructure should be accessible, safe, private, and comfortable for all users, accommodating diverse needs. The principle of nothing about us without us emphasizes that inclusive practices which meet diverse needs lead to empowered staff, improved quality of care, and better health outcomes for everyone. Please explore the reference section for this module to access links to all the resources mentioned. Also, if you'd like a more in-depth exploration of GEDSI, please take the Open WHO course, Mainstreaming of Gender Equality, Disability, and Social Inclusion in WASH in Healthcare Facilities.